are many different viewpoints on how to set proper fees for a practice, and I definitely won't tell you what rates to charge, but I will go over a few different things to look out for when you are setting up fees. The first thing to keep in mind is your usual and customary fees, or your UNC fees, must be the same for each service code across the board. So for example, you can't charge $100 for a 99213 to one insurance, but then charge $150 for the exact same service code to a different insurance. One code, one price, period. This technically also goes for patients who don't have insurance or cash pay patients. You cannot set a global discount for patients that don't have insurance. The fee must be the same for an insured patient as it is an uninsured patient. However, most of the time you can charge the same fee to every patient, but then give a prompt paid discount to the patients that are paying at the time of service, rather than you having to submit the claim and wait for insurance to pay for it on a later date. As long as your practice is acting in good faith and keeping the prompt paid discounts consistent across the board, you should be fine. The key is keeping an updated policy manual that spells out the exact circumstances when you would apply a prompt paid discount, and make sure that it is consistent for every single patient. This kind of policy will help keep your practice in compliance with federal and commercial contracts. Legalities may be different in different states, so definitely check to see what the law is written like in your state before you make a decision about this topic. The next step to determining your fees is to look at your biggest payers' fee schedules. One that you will for sure want to look at is Medicare, because a lot of times they're going to have higher reimbursement rates than other insurances. Even still, I like to go ahead and look at a few different of our top payers' reimbursement rates to see who has the highest reimbursement rate for a particular service code. If Blue Cross Blue Shield pays $100 for a particular service code, but Medicare pays $120 for that same service code, you would want to set your fee at least $120 or even a few bucks higher. You don't ever want to accept less money than what an insurance company is willing to pay you, right? Therefore, you will want to set your fees based on the highest reimbursement rate. Most of the time, you can find a fee schedule for an insurance either on their website or portal, or they'll at least have some kind of form to fill out so you can request that they send you the fee schedule. Take a look at each of these fee schedules and compare the different rates before you set your fees for your practice. Remember, fee schedules and reimbursements can change for insurances from year to year, so you definitely want to make sure that you're checking for these changes at least annually. There are times when some insurances will ask that you report your UNC fees to that insurance company for their records. Quite often, the insurance companies that do request these UNC fees do so when the doctor first comes under contract with that insurance. If you are working with any of these insurance companies that do ask you to declare your UNC fees, make sure that your fees are staying updated in their system. BSP, for example, has a place where a provider would enter their updated UNC fees for lenses at different service codes. For convenience, we have included a couple links to Medicare and a spreadsheet in our practice enhancers that will help you easily compare and track different fee schedules.